The lifetime risk of developing pancreatic cancer is about 1 in 71. The average survival rate of the potentially fatal disease is about 5%. Currently, no cure is available for this disease, and patients that are diagnosed with this particular cancer typically die within 1 year. This low rate of survival is mostly due to lack of symptoms, late screening, and a naturally quick progression of the disease. Pancreatic cancer usually develops in the cells that line the duct system of the pancreas, commonly classified as an adenocarcinoma. This is one of the deadliest forms of cancer. This disease is aggressive and difficult to treat because of its inaccessible location and its closeness to other organs. A sedentary lifestyle, tobacco use, and increased age are believed to be contributors of this type of cancer. Some common symptoms of this disease are jaundice of the skin and eyes, abdominal and back pain, weight loss, and poor appetite. The most common treatments for pancreatic cancer are chemotherapy, radiation, and surgery. The type of treatment largely depends on the stage and the size of the tumor and the patient's general health. If the tumor is inoperable, chemotherapy, radiation, or a combination of both may be used. In the unfortunate case that the cancer has spread to other parts of the body, controlling the patient's pain level and improving quality of life is the primary concern. Ongoing research and clinical trials are being done to find new cures and treatments for this deadly disease. Researchers are performing clinical trials of testing new combinations of chemotherapy drugs as well as developing new target therapies. Current research is being done to develop specific target drugs that inhibit the epidermal growth factor receptor and angiogenesis within the pancreatic cancer cells. Researchers have already developed a drug known as erlotinib that, when used in combination with gemcitabine, inhibits the growth factor receptors, preventing the tumor from growing. Scientists have developed anti-angiogenesis drugs that inhibit angiogenesis of blood vessels, thereby cutting off the blood supply to the tumor in which it needs to grow. Immune therapies are being studied as well. Researchers are studying pancreatic cancer vaccines that are meant to stimulate the immune system and attack the cancer cells. These vaccines are used to help in the shrinking of the tumor or possible prevention of the tumor reoccurring after surgery or treatment. Current research being led by Mayo Clinic is discovering that there are 3 necessary participants in the formation of pancreatic cancer. Scientists studying the relationship between the oncogene Cras, the epidermal growth factor receptors, and the p53 gene have found that with a mutated Cras gene and the inflammation of the organ, the epidermal growth factor receptors are turned on. Their findings suggest that without epidermal growth factor receptors, the tumors do not form. This breakthrough will hopefully lead scientists down the path of one day developing a cure for pancreatic cancer. Although there is no known cure, preventative measures such as maintaining a healthy diet and exercise regimen may be taken to significantly decrease the chance of developing pancreatic cancer.